There's a trial in progress that we are running here in the UK that's running in a number of UK sites looking at the qualitative outcomes for patients on targeted therapies. So we know when we come to conferences and hear all the trial outputs for patients with CLL and with other lymphoid malignancies, that the focus is often on, the primary, the secondary endpoints, which are response rate, progression-free survival, some of the toxicity data, but it's always taken from the medical perspective rather than the patient's perspective. A lot of the diseases we treat are essentially chronic diseases that the patients are going to live with for the rest of their life. And so how they experience things, what improvements in symptoms they get from their disease whilst on treatment is really important, but also the toxicities they get from the treatment are really important. And, a grade 3 adverse event for one patient may be very different to the same grade 3 adverse event for another patient if, for example, it's only lasted a few days in one patient, but for the duration of the therapy in another patient. So what we hope to get is the patient's perspective. And I think that it is really important to look at these things, the qualitative outcomes from all the drugs that we are giving, because it does lead us to be able to, when we're talking to patients about treatment choice, be able to better give them the information on how it will affect their life on a day-to-day basis.